Today, let's talk about metabolic factors that can affect someone's neurological recovery. When we see patients with neurological disorders, whether that disorder is a migraine headache, whether it's POTS, whether it's traumatic brain injury, there are a lot of reasons why someone's neurological disorder may not be getting better. And sometimes it's not strictly just a neurological issue, but there can be metabolic issues that can interfere with the healing process. Here are the big three that we run into that frequently cause problems. Number one is definitely going to be autoimmunity and chronic inflammation. One of the hallmarks of an autoimmune disease is that their illness can sometimes attack in flares that are seemingly random, or they're exposed to a trigger that stimulates their immune system. The problem with these disorders is that when someone is doing well neurologically, but then their immune system starts acting up and has a flare-up, then you could see a regression in someone's pain status. So this is particularly important for conditions that predispose people to chronic pain, and fibromyalgia is probably one of the hallmarks of this type of a problem, which people are now starting to understand is actually probably an autoimmune disease. But this can also affect things like traumatic brain injury, where in the brain you could actually have activated immune cells inside of your brain called microglia, which can disrupt things like your blood-brain barrier, and that can leave neurons more predisposed to dysfunction that's going to leave people more prone to brain fog and dizziness episodes. Number two is going to be anemia. Now, anemia can come in many different varieties. So you could have hemolytic anemias, which are caused by different autoimmune diseases. You can have iron deficiency anemias, in which your body's not storing and using iron well. And you could even just have diseases where your bone marrow are not producing enough red blood cells. But in either situation, if you have an anemia, that means the oxygen carrying capacity of your blood is not able to transport that oxygen well to your brain. And if your brain and neurons don't get enough oxygen, then you don't have one of the things that you need to burn fuel in order for plasticity to occur and for these changes to take hold. And we see this problem happen in a lot of dizzy cases as well, where if you're anemic, then you're more prone to dizziness symptoms. The third issue is insulin resistance. Now, you might be more familiar with insulin resistance if you have something like type 2 diabetes, but you can even have insulin resistance even before the diagnosis of type 2 diabetes comes into play. So if you have insulin resistance, that means that your ability to use glucose to make fuel, to activate neurons, is going to be compromised. And a lot of this starts at the level of the mitochondria. So the mitochondria are the energy producing organelles of the cell. And if you have mitochondrial dysfunction, then at a fundamental level, then your brain can't use oxygen and glucose to produce useful energy in order for the neuron to do its job. We try to look for signs of these things when we're doing a consultation with a patient, because we know that if someone has an uncontrolled autoimmune disease, they have an active anemia, or if they have uncontrolled insulin resistance, that we know that they're not going to get the full benefit of a neurological rehabilitation program. It's also to say that metabolic health is a big component in brain health. And now if you have an active metabolic disease, then you need to make sure that that's treated by a physician. But if you have suboptimal metabolic function, then those are things that can be addressed with exercise and diet.